Considering a hair transplant? Had one before? Are you a hair transplant professional? HairTransplantSociety.com is for you. We're connecting patients with each other to share experiences, connecting patients with clinics and doctors, and connecting clinics with employees. Join today.
It was a fun experience. I wasn't even nervous. They made it so comfortable, like coming here, I wasn't nervous to have it done, and like I said, it was virtually painless.
So, what's everyone saying to you, my friend?
Yeah, like I said the other night, I was in my neighbor's garage that's seen me thousands of times, and he's looking, he goes, dude, I can't stop staring at your hair. He goes, you went from 55 years old to 40 years old. I just couldn't, no one can believe it. And you're talking about the suture lines.
Right.
Halloween, we were at a Halloween party,
right,
telling some people we did it. I had like 5-10 people trying to figure out where that cut was in my hair. And like I said, you couldn't even find it. They couldn't find it.
Well, that's great. And
I'm just shocked by like how good it's been.
Tell us where you're from.
I'm from London, England.
London, England.
Yeah.
Okay. And how did it work out that you came here?
Like I was researching online, like everyone does, I suppose. When you're losing your hair, you're in denial for a bit. But then I knew that there's something I wanted to do, and I just found this by chance. I saw a video. I think it was on YouTube, and I was like, and just from how you presented yourself on the video and the methods you used, I was like, who is this guy? And then I found the website. And
so let's take a look at the hairline up close. When we do the hairline, what we want to do is we want to put the tiny little one hair grafts all the way around the front. So all these tiny little hairs you're seeing here are the one hair grafts, which create the softness of the hairline, and so it looks nice and natural. Then what we do, and I'm just going to turn just a little bit here, thank you. Then we create a little bit more density by using a graft called the follicular unit. The follicular unit is the naturally occurring bundle of hairs that transitions further back to create more density. Behind that, we use something that's called a multiple follicular unit graft. I'm just going to have you tuck down just a little bit, which is a graft that will have 2 or 3 of those bundles in it. But as you can see, it's completely undetectable in comparison to everything else. It looks nice and natural because it's his own hair. So now let's take a look at this other side here so you can see the other hairline. Once again, the tiny little one hair grafts are on the front, little 2-3 hair grafts hidden back there, and then the strong grafts further back. And I'm just going to tuck your head down just a little bit for me. Everyone wants to see it with the comb brush through it to see what it looks like. And as you can see, nothing is detectable to the eye.
I sometimes feel my hair's too thick some mornings. I was expecting a bit of it.
To have your hair be too thick, that sounds like a good problem to have, my friend.
The results achieved were better than expected, and that always makes an investment worthwhile. I would recommend Dr. Bolton to anybody that I know. I think the procedure and care was very well communicated to the patient and very honest about what their expectations could be. I feel that it was well presented. I feel there was no pressure in making a decision. I feel that all it was here's what the results are for some people. Your results could be better, could be worse. There was no promises, and there was no pressure tactics of any sort. It was basically an education in the process, and the decision was entirely up to me.
And I went on the website and I looked at the pictures of before and after, and I was blown away. When I called initially, the professionalism is you know, second to none, and I could tell I was in the A league as opposed to the B or C league that I was used to dealing with. When I came in to Dr. Bolton, my first goal was to be out of the hair system. That was my first goal, and they pretty much told me without telling me that this could be very possible with one surgery. So I came in and was using a clip-in at the time so I could prepare for the surgery. And after 5 months after the surgery, I was out of the hair system. You know, the way it looks after the fact, you know, the before and afters, or you can't beat it. There's no place in the country that does that. I was blown away with the hairline. I had an old hairline that that Dr. Bolton had to tend with, you know, fight with, that wasn't that great, and he's an artist, and you could just see that, you know, the work and the time that goes into something like this. couldn't be more happier where I'm at 8.5 months. I didn't think it was going to be this much. You always have hopes that it's going to be this much, but you don't realize till you actually see it. I had doubts because of my first 2 surgeries and everything else that went along with it. But I'm looking forward to the next couple of years and see where I'm at. Hopefully over the next 3 months I should have some more growth and take it from there. I would say to Dr. Bolton, thank you for giving my life back. It sounds maybe shallow, but it really hindered my quality of life. He gave me a quality of life back, more or less, than a life. And I couldn't thank him enough. And I would always refer to him, always.